Welcome, everyone. Thanks a lot for joining in to this webinar today. We're going to be talking about health technology engineering program at Aalto University. So the agenda for today is to introduce the program itself, to introduce Aalto to you, and answer any questions that you might have regarding the program itself or studying at Aalto. So today we are a couple of people actually here. So even though I have pictures only of me and Jenny presented on the slide, we also have Zach, who will introduce himself a bit later, who is the head of one of the majors in the program. And we have Anna, who is helping us run the entire webinar of today. I'm Ivan Vujakle. I'm a program director for health technology engineering, and I'm also a professor at School of Electrical Engineering, where this program is hosted. And Jenny Tulensalo is our planning officer and learning services representative who will be helping out with any kind of technical and administrative questions as we move along. So please feel free to use the Q&A portion of the Zoom to ask any questions that you might have as we move along. Some of those we'll try to answer straight away, and the others we might try to address closer to the end of the presentation of today. So feel free to ask anything. It's the anonymous outlet for you to use, and we are here to clear any doubts and maybe help you in selecting the right choice of your potentially future studies. So I would like to begin a bit by introducing Aalto University to those of you who might not be aware of where it came from and how it came to be. So Aalto University is a relatively young university. It came to be in 2010, but it actually has quite a long history. It started as a merger of three old universities: Helsinki University of Technology, University of Art and Design, Helsinki, and Helsinki School of Economics. And what this effectively allowed Aalto to become is one of the leaders in all of these educational fields in Finland and throughout the world. And also, it offers a really immersive environment that is on the intersection of all of these disciplines. So it brings science, technology, art, and business all together in order to facilitate the best learning experience and potentially build up a better future for all of us. And this is exactly where also this program is trying to be. So if we take a look at the research and education impact in Finland, Aalto is number one as of this year when it comes to the impact that they provided in both research and education, and also it's very highly ranked globally. It has a long-standing interaction with industry, and this is something that we are quite proud of. And as you will see, this is something that also shaped this health technology engineering program. Finally, we are very proud of our international background, and you will notice also that apart from this program being in English, many of us are coming with international backgrounds, and we offer and promote our students to get exposed to things both in Finland as well as abroad. When it comes to health technology engineering itself, we are ranked 12th in medical engineering and 20th in technology in Europe. And this is something that we are seeing a progress year after year. We are a relatively new program. So essentially, we just had two cohorts who have started, so waiting for the first one to complete the masters, but are very excited with the things that we managed already to achieve. And I will let you know about some of those as we move forward. At the same time, we are one of the very attractive programs in the offering of Aalto, and our admission process is highly selective. So we're quite proud with the applicants that we are getting, and also with the students that have been enrolled in the previous 2 years that we have been working. This year, just so the cohort that has started in 2025 has gone through one of these selections, and only 16.4% of those who have applied have actually gotten enrolled into the program and selected for the program. One thing that Aalto University as a whole and our campus has really uniquely set up is its location. So, in the capital area, we're very well placed in order to collaborate with both the highest tech industries that are in operating in Finland, just in the neighborhood of the campus, but also what is very relevant for this program, we are within a 20 minutes bus ride from the Helsinki University Hospital region, so Meilahti Health Campus and Business District as well, which are the big kind of collaboration places for our students and for the research that we're conducting here. So, with this kind of location and the possibility to really interact with both clinical partners and industry partners, as well as the government sector, it helps health technology engineering as a program to be very translational and very close to the application as well. So, on the campus, we are really trying to leverage this interdisciplinarity that is natively present here. And given that all the six schools of Aalto University are at the same location, and we are all sharing facilities and the space that is around us in Otaniemi campus, it helps us meet different people, build different ideas, and really create some amazing projects that we are also proud to say that our students have been part of. There's a lot of learning spaces that are built for you as students to try to both help you focus but boost creativity as you move throughout building up your own ideas as part of the studies. The part of the campus is the student housing as well, and this includes both the housing and the guild rooms, event venues, and all the other places where students can meet to both study and relax and build maybe some future connections. One thing we are quite proud of is that Aalto is not isolated peninsula in Otaniemi, but it's rather a very well connected part of the entire capital region. So, on campus, you can either use a metro or a very good tram lines to reach any corner of the metropolitan area. This allows you to both select the places where you would like to spend most of your time and maybe live, as well as connect with literally all the facilities available throughout the capital region. And we quite like the fact that the Otaniemi campus has a very long, over 10 kilometers long coastline on the bay with a lot of natural resources and forests. But at the same time, it's just a few metro stops from the very urban area of the Helsinki city. And these kind of contrasts are something that our students and us as a staff have been very happy to enjoy in our day-to-day life. Now, essentially, in order for you to get the sense and a feeling of what campus might be, there is a virtual tour you can take. So here you have a link to the campus tour, and then you can explore some of these corners for yourself and try to at least start getting a picture of how a life on campus might be. Now, I'd like to jump into the details of the health technology engineering program, and I'd like to start with possibly the most essential question, and what is it about? So I do believe that you're here because you've had certain expectations and you have certain curiosities that bring you to both health and the technology as topics. And so the mission of this entire program is to take those engineering-minded individuals and provide them with skills, tools, and knowledge to design, develop, and evaluate both devices and solutions that would be dealing with health and medical sector and any kind of well-being applications. This is becoming increasingly relevant when we take a look at the world around us, where the access to healthcare, the need for personalized medicine, the epidemics we recently had, and mental health crises that are being experienced across the world, coupled with aging populations that are present in Europe, but also in other parts of the world. All of these being some of the pressing matters onto our societies, and we are definitely in need of new solutions and new ways of how to provide all of these in a better, standardized, and more robust way. And so the purpose of this program is to expose those engineeringly minded and technically minded to a knowledge and to opportunities to really develop new innovative solutions and to build futures that could be able to address these outstanding problems. Now, we do that not only by providing the basic educations, but we also try to expose you to diverse engineering and health topics through hands-on and practical examples. And we try to leverage that kind of interdisciplinary setting and the proximity to these different stakeholders within the health tech in order to expose you, train you, and motivate you to really benefit and create a profile that would allow you to tackle some of these issues. Now, how do we do that? We do that by striving to address a set of learning outcomes we would like everyone to have after completing the 2 years of studies here at our master's program. As you can see, these learning outcomes are all structured around the fact that we want you to being domain. We try to focus a part of these efforts on to design, development, and evaluation of devices, but also we want you to be able to understand, interpret, and create models and data processing setups, which will allow you to get a deeper understanding of both the systems that you're deploying as well as the needs of individuals that are interacting with our healthcare systems. We are also very much focused on having ethical and social issues as a part of our education. And this is something that is woven throughout both technical and more clinically focused topics that we are covering within both of the majors in the program. We are also aware that as engineers working in these topics, you will be interacting with individuals that are coming from very different backgrounds and might have very different understandings and potentially speaking a different language when talking about the same topics. And our goal is also to offer you opportunities to become better and to become more understanding of how to interact in this environment so that you can really both be understood and understand what are the challenges ahead of you, so that at the end of the day, your engineering can be really applied in the best possible way in this domain. Now, the whole curriculum is based upon this, and I will jump into a bit more, explaining that in a bit more details. But first, to kind of like give you the notion of where and how this all came to be, I'd like to introduce the team that is actually behind this entire effort. And so I have been the program director since the beginning of this program, and my background is in electrical engineering. I have focused on embedded systems, signal processing, but throughout my studies and my work in industry and clinics, I have found a way towards health technology engineering as something that I found extremely rewarding. And essentially, my contribution to this curriculum here is going to be more on the kind of embedded system side and the topics surrounding of interaction of technologies with humans in the loop. And this is a kind of a theme that I've tried to bring into this entire curriculum. With us today, we have a head of one of the majors. So Zach is the major head for health instrumentation and wearables. And Zach, maybe you can introduce briefly your background and kind of the part that you're playing in this entire program.
Sure. Thanks, Ivan. I'm Zach. I'm a professor here in electrical engineering, Department of Electronics and Nano Engineering, so a partner department to Ivan. My background is all in electrical engineering, all my degrees, but then my postdoc was in bioengineering. And before I came here, I had faculty appointments in this Department of Surgery and School of Medicine at UCLA, and then also in the bioengineering department at UCLA. Almost all of my research is medical imaging, diagnostic medical imaging. So I'm heading up the health instrumentation and wearables. And I work in a number of different wavelength regimes, one of which is the very far infrared. And I moved to Finland specifically for, let's say, a suite of hardware that Aalto had that I couldn't get my hands on anywhere else. And I continue to do medical imaging and diagnostic sensing with that sort of stuff at Aalto. So I'm glad you guys all attended, and hopefully we'll see your application soon.
Yeah, thanks, Zach. And we have a second major here, which is health robotics and signal processing, which is headed by Philip. Philip Elvander was not able to join us here today, but just briefly, Philip actually has the background in mathematics, and he comes into this entire topic by being fascinated with biosignals and all the kind of non-stationiarities and, let's face it, problems that come with it, because applying signal processing in other topics might pose different challenges, but they are definitely more stable signals than the one you would extract from humans. And kind of this challenge itself has been something that Philip sort of got interested in and thrived in, and he actually has created several courses that are surrounding these topics that are offered within the program. And also he is overseeing kind of a research in this domain, and within the major, he's trying to kind of pull all those staff members and courses that are surrounding the topics of health robotics and signal processing. Today, also, we have Jani Tullensalo, as I mentioned at the beginning, who will also be your kind of a main point of interaction for things related to the administration and any kind of technical questions that might be associated to the studying at this program. Uh, Also, there's a whole range of other professors and lecturers that are contributing here. I have just listed them, but I would advise you that if you're interested, you look them up and see how and in which ways they are contributing here. Um, Now, once you know who we are and why we've kind of been very eager to create this very translational focused, engineering based, yet medical application and well-being application oriented program, I kind of wanted to just clarify who is this program for. And essentially, as you can see already from Zach's and mine and Philip's background, we are a somewhat diverse bunch when it comes to experiences and skills and knowledge that we both bring in and continue to pursue. And this is something that we try to encourage also from our students. So if you are someone who is engineering minded and have technical background that is seeking to apply themselves into a health and well-being sector, this is the place for you. So we really think that with certain kind of a core knowledge, like having the basics in mathematics and physics, and then topping those off with some programming skills, you will be able to navigate majority of aspects, at least at the beginning of the courses that we are offering. At the same time, having technical skills such as circuit analysis, embedded systems, and signal processing are going to really help out in getting deeper across the topics. Also, if you're depending on the major that you choose, perhaps a bit more understanding of the control fundamentals or background, having a background in topics like mechanics might be beneficial, but not something that we are strongly expecting from you to have when jumping into this field, as we will provide certain basics and build up so towards it. Same goes for human anatomy and physiology, while we would kind of expect that you are curious and willing to learn more about it. We don't have a core expectation within this domain, but it's definitely nice to have. And then many of the courses do build up on knowledge of basic statistics, multivariate calculus, and matrix algebra. So these are something that we are looking in our applicants to be at least familiar with, because it will help you both enjoy and apply yourself better throughout many of the courses that are being offered. Now, the structure of the program is fairly straightforward. So we have a block of 35 ECTS, so the credits that are dedicated to mandatory foundational courses. And these are going to be taken by everyone who is participating in the program. And then there is additional 25 credits that are fully elective and are there to choose from any of the offerings across Aalto University and create your own niche and your own profile throughout the studies, so that once you graduate, you will have both a staple and the understanding of something that is really focused on what you wish to pursue within this health technology engineering domain. Now, on top of these, there are two majors, and each of them are worth 25 credits. So there is health instrumentation and wearables as one major, and health robotics and signal processing as the other. And I will jump into these in a minute, but all students are then going to be also completing 30 credits worth of thesis activity, which typically comes as a last effort that you have before graduating from the program. And there are, in parallel, typically taken 5 credits worth of thesis related activities that are skills and tools that will help you not only complete your master thesis, but also just get better in scientific communication and sort of structuring and communicating complex topics across the field. So let me try to show this how it looks in a bit more structured way. So as I mentioned, there are these 35 credits worth of basic courses, and that's this block just right here. And so within it, what we offer is, for instance, courses on biomedical instrumentation. And this is sort of a very foundational of the courses for everyone participating in this program. Same goes with biosensing, that is more focused and on the forefront of the topics related to sensing as a general concept and the approaches. And this is actually a course that is given by most of the professors involved in the health technology engineering program here at Aalto. And so you will get exposed to many different modalities and ways of collecting biological signals. Then there are two courses that I would like to highlight on top. This is the Introduction to Human Movement Biomechanics and Principles of Health Technology Assessment and Regulatory Affairs. They are unique in Aalto University's offering, and what we are starting to understand, they're also unique in European landscape of education when it comes to this field. The first course is actually given in collaboration with the Children's Hospital here in Helsinki, so that Meilahti campus, 20 minutes away from here that I mentioned, is actually where the hospital is located, and the experts in biomechanics from that hospital, along with some of our staff, have created this course in order to expose engineers to the field of movement biomechanics, but also to retain a very strong clinical relevance. And actually, as luck would have it, just next week, next Wednesday, our ongoing cohort will go to the Children's Hospital, and alongside clinicians will do measurements that are related to this course in order to have very practical insight into the topics that have been covered throughout previous lectures, and they will have assignments that will then be done using the data that they collect inside the clinics. Uh, the other course, the Principles of Health Technology Assessment and Regulatory Affairs, is a course that we are quite proud of, and it has been actually something that in discussions with industry we have gotten as a sort of an advice and even a request from some of them to have it included, because in the modern day of health technology engineering, engineers are expected to have a knowledge and understanding of regulations and directives and standards that are being applied on this field. And so we have designed this course in such a way so that it introduces really engineers to the relevant topics and not overburden everyone with very kind of a dry topics that might be more suited for those interested in legislations, but rather to give tools and means to engineers so that they know how to design and interpret the consequences of different regulations onto their own solutions. We have invited lecturers from industry that will then be giving their master classes as part of this course throughout different weeks, kind of making sure that we always have our students exposed to the latest within the field and also the most concrete practical applications of both health technology assessment and regulatory affairs. Um, Apart from what you see here, there is a project work course that is worth 10 credits, and essentially this is a place where in teams you're tasked to solve actual health tech engineering challenges. So what we do see is that students very much enjoy working in groups and working on real topics. On the right-hand side, you can see some of the examples of problems and challenges that have been addressed throughout this project work course by health technology engineering students. And I'd like to just highlight an example which came from actual needs from our partners in the public sector, which is creating sensorized diapers for elderly homes, which are supposed to help the nurses in taking care of and monitoring the inhabitants of their care homes. And students were tasked with designing a prototype over the course of 3 terms. So essentially, this is a quite a long 10 credits worth effort, but because the idea is to have a gala, a presentation at the end of the course where you can showcase the achievements that you have done throughout the entire semester. Upon completing these 35 credits worth of courses, there is a choice of 2 majors. So each of them were being worth 25 credits, and those 25 credits of elective courses that, as I mentioned, are there for you to pick and choose courses that you believe will give you the knowledge and understanding of the topics you're highly interested in, and profile yourself in the direction within health technology engineering that you find most beneficial. This is not something that you need to do purely on your own. We do have all students assigned with tutors and mentors from staff that will help you out in discussing some of these choices. And throughout the 2 years of the master's program, you will have appointments to talk with them and kind of revisit both your study paths as well as your career paths. Finally, 35 credits that are left are focused primarily on the master thesis, and the students, as you will see, have opportunities to do their master theses at various outlets, both at the university and in our industry and clinical partners. And there are these 5 credits of master thesis process and academic skills that will help you master the communication as well as the kind of uptake and understanding of complex topics that are part of each master thesis that is being done in this program. I wanted to highlight this biomedical instrumentation course as well because it's one of the places where you will really get to interact with actual clinical devices and to understand both their benefits and limitations, as well as the kind of underlying processes that have led to their designs. And this kind of is going to set everyone up, regardless of the major that you're going to choose, and with a general understanding of what kind of instrumentation and devices are there. However, if you choose to get more in-depth into instrumentation and particularly wearables, we have the major that focuses on it. And here you can see that the list of courses is kind of a focused on the engineering aspects of building up these solutions. But at the same time, I would like to highlight one particular course, which is designed for reliability. And this course is something that is highly relevant for building up solutions, such as wearables or embedded systems for monitoring patients in this health tech domain, because unlike the general purpose electronics, the room for errors and the request for robustness is very, very high here. And so in the design of reliability, you will learn how to both assess the reliability of the devices that you're building, but also plan and design reliable devices from the prototype stage to also how to prepare them for mass manufacturing and testing so that the reliability can be maintained throughout the entire product cycle. Now, moving on to the second major, it is focused on health robotics and signal processing. And here we will have a more exposure to scientific data analysis as well as machine learning and maybe most uniquely applications related to building up human in the loop systems. So unlike traditional engineering and automation, what we are faced here in the health technology engineering is the need to really have this strenuous agent of a human in the loop, which is highly unpredictable, very kind of a non-cooperative, yet very demanding as a control agent, if you will. And building up systems that operate in this domain is not simple, and it takes actually somewhat a different approaches than you would have in traditional automation and robotics. And we have a course on neurorobotics that is dealing with these topics and is going to kind of teach you how to apply automation and robotic principles, both in design and control, for specifically these type of situations. This program hasn't been built on its own, and it's not just a product of our expertises that we had here at the university, but it was rather tailored in collaboration with many of the big industries that operate inside our ecosystem. So here in Finland, we have a lot of R&D taking place in health tech domain, and we have reached out to these industries and public centers and public sector representatives to help us build up a program that is going to be relevant to them, but also to future-proof it, so that this degree and the knowledge that we are providing here remains relevant for the years to come. And we wanted to make sure that the potential employers might find it beneficial to seek students from this cohort. And so what we have also seen is that in these first two cohorts that are currently attending our program, there have been many who have found their master thesis works in the companies. And that's one part that I wanted to point out, that in Finland, it's fairly common to do your master thesis, at least in our School of Electrical Engineering, as a part of a company and or a public sector institution. And we encourage our students to do so and to also seek their opportunities in broader context. We also, of course, offer opportunities at the universities and within the individual research groups, and there is a portion of students that follows up with their master theses at Aalto or at any of our partner universities. Um, we are very proudly an international community, and we do try to instill this sense of internationalization in our students and our graduates. So apart from having a very diverse staff and subscribing to a study language being English in this program, we also do offer international opportunities. So there are exchange studies as a opportunity for our Aalto students, and the health tech engineering students are included into these partnership. So typically during the second autumn of your master's studies, if you're seeking to maybe get further exposed to another international environment, this is the good time to potentially explore those opportunities and see what might be out there for you apart from what is being offered here. We also have seen students pursuing international internships and doing theses with other international companies and institutions outside Finland. And this is something that we are happy to support our students if they see that it's something that makes sense both for their learning and for their careers. Um, so Alpha graduates have a very successful kind of a pathway following the graduation. So the last surveys that have been done at the School of Electrical Engineering have shown that the majority of the graduates, almost 100% of them, actually get employed within the 5 years after graduation, and that 96% of them believe that their degrees are valued by their employers. And being closely kind of in touch with many of the stakeholders within the health technology engineering sector, and making sure that we do make our programs in such way so that they can also facilitate different needs of the stakeholders out there. We have been having the same sort of response from our graduates, even though we are still to get the first ones fully out of the program. And then what is also very interesting is that the Aalto alumni tend to be founders of many different companies, mostly as a result of what we see this interdisciplinary environment. And so around 65% of companies in Finland have Aalto alumni as board members. And 68% of graduates in 2024 have had the work at the time of their graduation, and 18% of them knew exactly where they're heading off in a short amount of time after the graduations. And 22% in 2024 were seeking for a job straight after the graduation. Now, studying at Otaniemi campus is a very kind of engaging experience. because there's a lot of traditions that do stem from really this kind of a student life. And international students and local students have been hand in hand, both building up on these traditions and creating new ones. There's a lot of events and a lot of opportunities to get engaged in the student life. So there is a community that is fairly strong, and health technology engineering is also part of different student guilds. And we have our students being both representatives and highly engaged in these kind of different student bodies. Sports is something that is well present and represented at the university. We do have our own field, both indoors and outdoors pitches for various sports, and there is essentially something for everybody. If you're into music, if you're into cultural exchanges, all of those and many more are available both on campus as well as in our kind of immediate surroundings. So Helsinki metropolitan area being the capital area is a very vibrant one. At the same time, Helsinki and the surroundings are easy for living, and they do offer a good quality of life with the access to many of the day-to-day utilities, but also some others that might just make this entire studying experience much more pleasant. Um, what also Finland and Aalto do offer is a number of student benefits. So there are discounts across Finland that are available to our students, starting from just lunch and canteens and public transport system being subsidized for students, to housing that is being offered from the Aalto Student Union to those that are enrolled in different programs across Aalto University. And Finnish Student Health Service is something that is available to the students, and that covers general and dental health care to all those participating in studies at universities in Finland. Also, as I mentioned, sports is a part of kind of Aalto campus, but also across the city, there are many venues and many opportunities to get very good services that are tailored to student needs and requirements. Um, for admissions, I would encourage you to take a look at what is available online regarding the exact procedures and expectations. Then application period for masters is once a year, and you will find in these pages the application instructions and any kind of additional informations on tuition fees, scholarships, and requirements. If you have any particular questions that you might come up with, you can always send an email, and the most kind of a knowledgeable person on the topic will try to answer those very promptly. But also, I would encourage you to engage now with us if you want. So I'm available here to talk about the program and anything related to the content of program. We also have here Jenny and Anna who might help with any kind of more administrative and technical and practical matters of studying at Aalto and getting enrolled at Aalto. And there's also Zach who is here who can help you with the specifics of some of the majors and some of the topics, and can give you also, if you have any questions related to particular topics, he can give you also another view of those. So yeah, at this point, I would really like to invite you to let us know if there's any questions or anything that you would like to do. So please feel free to use the webinar chat, and there is also the Q&A opportunity in the Zoom. So what are the admission rates for this master's, more or less? So are we talking about admissions rates in terms of the amount of student applicants that actually turned successful? That's around 16%, at least what we've had from the previous year. If we're talking about study rates and scholarship, I would suggest maybe looking up beyond that link, because I am not sure, but I don't know if Jenny or Anna might have this information for the upcoming year.
I would interpret the question as you did. So, what was the actual successful rate of
Yeah,
admission in previous year? But please do resend the question if it was not answered yet.
perfect. Do you have any other doubts or um, maybe in more general terms, now having heard this, do you think it matches the expectations you've kind of had for the what this program would be about and what the studying at Aalto might entail? So maybe if yeah, there is okay, there is a question about what are the future scopes of the program. Um, so thanks for asking that. We have seen our students, particularly those that are now in the process of completing their master thesis, is getting a variety of opportunities for the kind of their employment and for their future careers. What is kind of interesting is that we have those that are very focused in the health technologies and the R&D aspect of it. So we had students who went to work for bigger companies like GE Healthcare and developing tools and solutions within their portfolios. We also had students who joined startups and have been very successful in applying their both technical knowledge and knowledge of the topics because they are equipped with different set of skills than the traditional electrical or mechanical engineers would do. And so in the startup environments, they have been kind of key players in but specifically translational activities, and that's maybe what we are seeing also from the type of master thesis topics and the roles that they've been assuming that this has been the case. One thing that came also for us as a surprise, but a very pleasant one, is that our healthcare services and providers, so kind of the national services, as well as cities like the city of Espoo, where Aalto is based at, have been employing our students to help them in transitioning their technologies towards more human interactions. And they've understood that students with the health tech engineering background are suited for getting their services and solutions to become more automatized with the human-centered approach in the middle. And that's been something that we're very, very happy about. Um, I hope that that answers the question. Then, what are the admission requirements for non-EU students? I think that in the webinar chat, Jenny has already posted some links where you can look at the specific details for those because they do differ from the background to background and the target application. So I would perhaps instruct you there, and then also you can ask for specific questions to admissions where someone who definitely has more understanding of these nuances than me can help you out. Um, there is also a question that there is a consideration of the quality of the previous institutions in the application, and so what would be considered good ranking for a university? I think that this is something that, again, I might point you out to Jenny to provide the information on how exactly this is handled, because this is handled at the level of the university, not specifically at the level of the program. So when we are kind of deciding and doing the program level decisions, this is already something that is provided to us as an assessment. So Jenny, I don't know if you want to either in a chat answer or how would that be? Okay, so
I can maybe type in the chat, yes, for the in the general webinar chat.
Perfect. Thanks a lot. Um, I'll try to maybe read then the next question, which is, are the people with bachelors in computer science and engineering allowed for this, or should they do any bridging courses? I would say, in general, yes, we are happy and we have students coming from computer science background that are enrolled in our programs and actually doing quite well. But I will put kind of an asterisk there. It depends, because we've seen also that computer science across different universities might include very, very different topics. So it also comes down to maybe nuances of the specific application. But in general, computer science and engineering have been successful applicants, and they have been enjoying and doing quite well within the program. So in general, yes, but with kind of a small reservation depending on the specifics of that particular program. As long as there is strong mathematics and physics, and the engineering topics are being covered within the reasonable set of domains, this is something that should be no problem. Yes, I hope that answers the topics so far. Yeah, but thanks a lot for the questions. If there's anything more that I could try to answer, I'm happy to. And also thanks Jenny and Nana for answering the more kind of administrative and technical questions. I would also encourage you to perhaps look into the course list that I have provided previously, and look at the professors and lecturers behind those, and maybe get a bit more familiar also with other topics that are present within the program, and kind of learn about from what are the specialities and activities of everyone involved here. Um, So, what is the general acceptance criteria? Is it CGPA based or project based? Um, I have to say that I am not entirely sure of what these are. Would you mind elaborating a bit more on it? Because again, with different educational systems and different sort of application criteria, that this might differ. So if you can elaborate a bit more on it, then we can try to either I can try this, or maybe Jenny and Anna can help out.
Sorry. I would maybe refer to the link that I sent in the general webinar chat. So the other one is for the general admission requirements, and the second one is for like program specific. And the evaluation principles, what is looked at in your profiles, and how is that evaluated, it is explained on the second link. And for example, there we have the previous success in studies. And by that, we refer to mostly the GPA. It's of course, I mean, the relevance of the previous degree is another one, meaning that you need to have sufficient previous knowledge as it was presented in this presentation before, but also then how you performed those studies. And that is mainly looked at from the GPA of the previous degree.
Yes, thanks, Jenny. Okay, I think I also understood now fully the question. And yeah, so the success in previous studies are being looked through the GPA, and then so of course, if all of those criteria are fulfilled and the relevance is there, any kind of project or like extra work that has been done within the field will be kind of a welcomed and put on top of the success rate. But yes, the bases are, I think, best explained in the document. Right. Do you have any questions regarding the specifics of the studies as well, or the topics that are being covered? Um, okay, so there is a question regarding the graduation dates and being in the application before the formal graduation. So again, I think Jenny, maybe you can comment on this.
Yes, so that's also explained in the general admission requirements and instructions page. So you may apply with an incomplete degree. So if you're still in the middle of your final semester or just about to start your final semester when our application period is already ongoing, you can still apply. The deadline is such that you must graduate by the end of July and submit the final degree certificate by a certain deadline. But basically, during the evaluation process, during the application and admission process, your studies so far are considered. So final semester studies, you can, for example, include a list what courses you will be taking, but obviously, since you don't have results of those studies yet, they are not cannot be considered obviously in the admission, but that doesn't prevent you from applying.
So is it compulsory to graduate with honors in bachelor's? Um, again, I think I'll refer back to Jenny on this.
I mean, we don't have like a specific GPA or degree grade limit as such. So obviously, the better you have done, the better you have succeeded in your previous studies, the better chances you have. Uh, it's like competition. We have a certain number of seats in the program, and may depend a bit on the number of applications as the overall level of applications. So if there happens to be a really high, extremely high level in this winter's round, it might be that the GPA limit rises higher than last year or the other way around. So honors as such, like alone, is not a requirement for admission, but the better you have succeeded, of course, the better chances you have. So no like precise answer since we don't have any specific written requirement for that grade or degree grade.
Okay, any other doubts, questions? So there's a question about publishing previously. Again, this is going to be taken into consideration as a holistic aspect of the applicant. So sure, having experienced publication or publishing process in a relevant field previously is something that is a demonstration of certain type of skills and exposures. But again, it has to be taken into consideration from the application as a whole. So it's kind of it's a plus, but it's not seen as a must, nor is it solely going to weigh in on the overall decision in a way that some other aspects that fit into a holistic consideration of the applicant would otherwise do. So it's a plus for sure if it's in the field of studies, but it's not going to be a sole thing to consider in the admissions process. All right, I think we can slowly wrap up now. I would really like to thank everyone for joining in and for being so active at asking questions. So if you have anything else that still might be on your mind, I would refer you to the links and to the information that have been provided also in the chat and in this presentation. And for any kind of specific content related to the master program itself, so you have met us now. You can reach out about these things, and we can try to help you out. For anything again admissions related, I would instruct you anyhow to contact the admissions at aalto.fi, because they will have the most suitable people to answer any questions you might have. So thanks again, everyone. I would also like to thank Jenny, Anna, and Zach for joining in and helping out. And yeah, we hope to hear from you and see your applications in the next application round. Take care, everyone, and have a great weekend.